Welcome to Inside Healthcare with CEO and President of MagnaCare, Joseph Berardo Jr. Today he'll be discussing micro-networks. What is a micro-network and how are they organized?
A micro-network is really just another name for an accountable care organization. The accountable care organization term has been used very loosely throughout this whole health reform process and discussion. For the most part, what we're seeing in the marketplace are providers that are organizing really into smaller groups, multi-specialties, hospitals, ancillary providers, and they're basically organizing themselves in order to communicate better, share information, and ultimately serve a population in a more efficient way. MagnaCare has been experiencing and helping providers organize by basically bringing together affiliated groups, not necessarily employed groups of providers, hospitals, and ancillary systems, and organizing them into a product. These products, for the most part, sit at the nucleus of our broader network. So for certain populations that are geographically lined up with these micro networks, the opportunity to have a health plan that's based around a small group of integrated providers and have them provide coverage to their members in a more efficient way is available today. So we're calling them micro networks because for the most part, the reimbursement model that the providers are receiving has not changed much from the one that we've seen historically. But over time, it sets up the ability for these providers to organize into true accountable care organizations that can take reimbursements on a case basis, on a global basis, and really move towards the efficient way that we need to reimburse for healthcare. But out of the gate, a micro network really allows for an employer plan sponsor of a self-insured health plan to pick the provider network, create a plan design that incents their members to go to this integrated delivery system, see that their care is more efficiently managed, no duplication of services, care in the right setting, no unnecessary emergency room visits, no unnecessary hospital visits, and make sure that the plan and the information is shared between multiple providers on behalf of members, especially those with chronic illness. So a micro network really is the beginnings of providers organizing themselves into true accountable care organizations.
How are micro networks different from other provider networks?
The micro network, for the most part, really sits in the middle of the bigger network. So it's really integrated in a way where they're sharing information related to the patient. So they might be on a common medical record, or they might rely on MagnaCare to provide information back to each provider on the illness or the burden of illness that each member has. MagnaCare collects information through claims, pharmacy, lab, and lab values. That's very valuable information to a treating provider. It enables for people that have conditions like diabetes, hypertension, and other chronic illnesses, and in fact maybe multiple chronic illnesses, to be better managed by the providers that are treating them, making sure that tests and prescriptions are filled and there's no duplication of services. So for the most part, if you look at a micro network, they're really just sitting organized inside a broader network. It doesn't mean that members can't see other providers. There might be a different cost associated with it, but the micro network is designed to be a more efficient nucleus that's part of the program and the program of the future.
Who benefits from utilizing a micro network?
There's benefits for everybody. So if you're the employer that's financing the health care, you're essentially giving your members access, and in many cases you can remove copays to incent people to go to these micro networks. So you're basically, as the financer of healthcare, getting a more efficient model for your money. So what I mean by that is if you're not duplicating services, tests, and there's no unnecessary hospital visits, or the emergency room is avoided because you have a great urgent care network, you're saving money on the global basis. As a member, if you have access to a micro network, you may have your copays or deductibles removed or reduced, so you're getting an increased benefit. And from the provider's perspective, the providers in some cases are seeing increased volume to their practice because the plan design is incented to have people use them on a primary basis. But separately, they're also learning how people do use their system. They're learning how to communicate with other providers. They're learning how to communicate with the hospitals. And MagnaCare is the conduit for that. So using the micro network structure really not only gives the ability to deliver care more efficiently, it really provides incentives. It's one of those things where it's a win-win-win for all those involved. And that's not something we've seen in healthcare in a really long time.